All right, so I've got blue dye. Sorry, we've been dyeing kids' hair to keep them occupied during this stay-at-home order. It does come off, but hopefully it comes off my skin and I don't come back to work blue. Anyway, so we have part 3 of chapter 7 in your pharmacology book to do the lecture video today. So we're going to pick up on slide 31 that starts to talk about panic disorders. So panic disorders are described as a sense of fear, apprehension, or premonition of a serious illness or fear of a life-threatening attack. Panic disorders, or these can occur in public. They can occur at home. They can interrupt the individual's sleep. Symptoms include dyspnea, which is shortness of breath, palpitations, heart palpitations, chest pain, a choking sensation, dizziness, cold or hot flashes, feelings of unreality, sweating, numbness, and trembling. So causes are an amplification of incoming messages to a part of the brain stem that results in excessive arousal, excessive autonomic discharges, and an increased respiratory drive. So treatment, psychotherapy is used. Short-term anti-anxiety agents, so going back to the SSRIs, benzos, the use of buspirone or Buspar that we talked about in part 2's video. Other agents include beta-adrenergic agents, diphenhydramine, which is Benadryl. They use that a lot, especially at night. The hydroxyzine pamoate, and then tricyclic, so tricyclic antidepressants, so TCAs. Sleep disorders. So there's different stages of sleep. Stage 1 involves non-REM or NREM, which is non-rapid eye movement. In this phase, you are somewhat aware of your surroundings, but you're relaxed, and it accounts for about 4 to 5% of your sleep time. Stage 2 also involves non-REM or NREM, non-rapid eye movement. You are unaware of your surroundings, but you can easily be awakened. This accounts for about 50% of the sleep time. Stage 3 and 4 involves REM, which is rapid eye movement. You have an increased autonomic activity in episodes of REM sleep with dreaming. This accounts for about 20 to 25% of sleep time. And this phase 2 and 3, where you get the REM sleep, is actually the most important part of physical rest. Insomnia is a difficulty either falling asleep or staying asleep. I feel like I have difficulty staying asleep. I feel like my brain doesn't stop, and it'll wake me up and I'll be thinking of things that, I have no control over, or what I have to do tomorrow, and, things like that. It could be a chronic condition. It could be short term or transient, where it comes and goes. Transient is not considered a sleep disorder, but a response to an acute stressful event that is expected to improve over time. So there's different causes of insomnia. So situational, so job stress, hospitalizations, which makes sense. If you've ever been in the hospital, you don't get very good sleep because, depending on why you're in there and what's going on, a lot of times they're coming in every so often to take your vitals, which wakes you up. They're coming in for blood draws, lab draws, and they come in all hours of the day and night. Medical, you can have respiratory problems. A lot of people who have sleep apnea have difficulties with sleeping, GI problems. Psychiatric, so schizophrenia, depression, and mania have issues as well. So schizophrenia, a lot of times they're having auditory or visual hallucinations that prevents them from being able to get some good sleep. And then drug induced, so alcohol, caffeine are huge instances where you can have some sleep deprived issues. So not treatment of sleep disorders, so non-drug treatment or therapy. So normalizing the sleep schedule for a bedtime and waking up. So going to bed at a certain time, waking up at a certain time. increasing physical activity during the day, okay, wearing yourself out essentially. So by the time bedtime comes, you're tired and you're ready to go to sleep. Discontinuing the use of alcohol as a sedative. It's never a good idea. Sleeping a total of only 7 or 8 hours in a 24-hour period. So the less you sleep and the more you sleep can actually affect the amount of sleep you're able to get, can affect the ability for you to fall asleep, stay asleep, but also inhibits the amount of good sleep that you're getting. Reducing caffeine and nicotine intake, eliminating any drug that could lead to insomnia. So treatment of sleep disorders, so sometimes they do use benzos. Again, they are kind of steering away from these unless absolutely necessary because of the risk of addiction, but side effects of using the benzos include muscle weakness, impaired reflexes, difficult awakening in the morning because the drug has such a long half-life, so it's still working even in the morning when you're trying to get up, which can also cause some residual daytime drowsiness. Ramelteon mimics melatonin, so we actually have melatonin. We produce melatonin naturally within our bodies. This drug mimics melatonin, but it is more potent than the melatonin we produce. You can also purchase melatonin supplements over the counter in any health food store, and a lot of people use that to help them fall asleep and stay asleep. The nice thing about the drug that mimics the melatonin is that there's no hangover effect. So even sometimes if you take Benadryl, too late in the evening or the night, you have a difficulty waking up in the morning and you can still kind of have that hangover feeling. Z drugs. So this would be like Ambien, okay? It has a short half-life. There's no significant effect on REM sleep. Side effects can include sleepwalking, sleep eating, or sleep driving with no recall of the event. So this Ambien's not prescribed a whole lot because of these, those are sleepwalking, eating, and sleep driving are some pretty significant side effects. Because of the side effects, it can impair physical and mental capabilities. There's also a risk of potential behavioral changes. And it is a controlled substance, so there is that risk of addiction. So there's other Z drugs. So the Sonata is not a controlled substance. It's a short-acting hypnotic. It's the lowest risk for next-day cognitive function, but they require or recommend limiting the use to 7 to 10 days. Narcolepsy. Narcolepsy is a sleep disorder involving recurrent inappropriate episodes of sleep during the daytime hours. Characteristics: sleepy feeling during daytime with almost immediate progression to REM sleep. Cataplexy, or short periods of muscle tone loss associated with joy, fear, or anger. Sleep paralysis when falling asleep or waking up. And then vivid hallucinations at the onset of sleep. So treatment of narcolepsy, non-drug treatment, is a consistent sleep schedule. Again, setting a bedtime, setting a time to wake up in the morning. Avoidance of shift work, so working in the evening and overnight hours, and then avoidance of alcohol. So modafinil, which is Provigil, is one of the common, drugs used to treat narcolepsy. It can be used to treat narcolepsy. It is also used for people that have sleep or shift work sleep disorders. It does have side effects of increasing blood pressure and the heart rate, so that's something that they have to monitor. Alcohol dependence, we'll go ahead and stop on this slide here. So alcohol dependence is, actually we'll get through, hold on, sorry, I went the wrong way. So alcohol dependence is a pattern of alcohol use involving problems of controlling drinking, preoccupation with alcohol, the use of alcohol when even when it causes problems, drinking more to get the same effect, having withdrawal symptoms with rapidly decreasing or stopping drinking. So tolerance, over a period of time, your body does increase its tolerance to the alcohol because your body has an increased ability to rapidly dissolve or metabolize the ethanol. Neurons in the central nervous system adapt to the presence of alcohol. So impact on health is obesity, vitamin deficiency, especially the B vitamins. The B vitamins are huge. It's one of the things we replenish alcoholics with when they come through the ER, or if they're being admitted into the hospital. We prepare what we call a banana bag. And we call it a banana bag because it turns yellow. So it's a normal saline IV bag, usually a liter, 500 mLs to a liter. We put the B vitamins in it, so B12, all of the other B vitamins, and then a regular multivitamin complex, because the alcohol strips your body's ability from being able to absorb those vitamins and increases the rate at which those vitamins are excreted from your body. Gastritis is another impact on health, organic brain damage, alcoholic psychosis and dementia, and then of course the risk of cirrhosis of the liver. So dependence from alcohol is the inability to control the use of physical substance, a physical condition that cannot be controlled by willpower. Alcohol withdrawal symptoms include agitation, circulatory disturbances, convulsions, seizures, delirium, disorientation, hallucinations, mental disturbances, nausea and vomiting, temporary suppression of REM sleep, weakness. So in the other video we talked about the risk of seizures with alcohol withdrawal, and how that is potentially fatal. So treatment typically includes a benzo, because benzodiazepines, or benzos as we call them, mimic very closely alcohol, and we replace the alcohol with the benzodiazepines, and then we begin to slowly wean them off of there. We treat with an anticonvulsant just to prepare in the event that they might have seizures. And then folic acid, thiamine, which are B vitamins, multi-purpose vitamin to treat the underlying deficiencies, which is pretty much a given for anyone that drinks excessive amounts of alcohol. Camprol, and we'll really stop on this one. Camprol is used to restore the balance between the neuronal excitation and inhibition, which reduces the negative effects of the abstinence of alcohol. So it's one of the things that's used for alcoholics. They take it orally, and it's essentially getting their brain to not have those cravings. Any type of substance abuse, whether it's alcohol, opiates, heroin, cocaine, street methamphetamine, anything like that, over a period of time, your body develops a tolerance for this, because, for heroin users or opiate users, you will often hear them coin the term chasing the dragon. And the reason for that is they will never feel the same high that they felt the very first time that they used the drugs in excess, especially the heroin. And it's because their body develops that tolerance. So the longer they use it, the more they're going to need to feel the high, and it still won't be the same high as the first time that they used. On the flip side to that, when individuals go into treatment, so whether they go into rehab or they do a different type of detox program, and they come off of the heroin or they come off of the opiates, they actually have a very high risk of death from overdose if they were to relapse, because what happens is that their body and their brain just remembers the amount that they were using when they stopped, when they went into rehab, and when they relapse, they use that same large amount when their body hasn't had any for a significant period of time. And those levels, they worked themselves up to that level over a period of time, months, years, and when they have detoxed their body out, they're no longer using the drug for a period of time, and then they go back to it, they use the same amount that they were using when they stopped, and typically that is enough to overdose them because their body is not used to or accustomed to that high dose anymore. So that's one of the reasons why Narcan is such a good thing, and it's a good thing for Narcan to be available for purchase. In the state of Arizona, we have a standing order, so anyone can purchase it, not just the drug users, but family members. And this has come in handy because what was happening was you have a large group of people who are using or abusing opiates in some way, whether it's a heroin or prescription drugs, and family members are the ones that are discovering these patients, and they're needing the Narcan because the time from discovering that there's been an overdose to when EMS can actually arrive is a significant period of time, and sometimes it's the difference between life and death. So it makes a huge difference there. So we'll go ahead and stop there on slide 46. If you have any questions, please go ahead and give me a call or send me an email.